So welcome back. Today we'll be talking about dermatomyositis. And this is a disease that is fairly new in medicine in that it was just described in the late 1800s by a few physicians in Germany. And it is a type of inflammatory myopathy. These are a group of autoimmune rheumatological diseases where the immune system is overactive and they attack the muscle. But in dermatomyositis, dermato meaning skin in Greek, means that here the immune system is overactive and it's attacking the muscles and the skin. As far as the symptoms of dermatomyositis, the muscle that is being attacked in a very specific way. It's the proximal muscles, which means it's more the shoulders and the hips. And these patients can also get a lot of trouble swallowing. The skin disease is also unique in this condition in that it is a photosensitive skin disease or photosensitive rashes, meaning that they get worse in the sun. And the two that are the most specific for this disease are the heliotropic rashes, which happen as redness right on top of the eyelids. So when the patient closes their eyes, it almost looks like they have eye makeup on. And Gottron's papules, which are a red bumpy rash that's on all the knuckles. These patients can also get calcinosis, which kind of look like pimples that drain calcium, and they can also happen on the inside. These patients can get Raynaud's, which we already talked about. These patients can get lung disease. A fancy word for the type that they have is called interstitial lung disease. And sometimes these patients can get heart problems and joint problems. As far as who gets dermatomyositis, now I feel like I say this every time, it's a very rare disease because all autoimmune rheumatological diseases are. But in this case, you would need about 100,000 people in a room for even one person to get it. It is more common in women, and it has what's called a bimodal age distribution, a way of saying that this disease affects two age types. So it can affect little children from the ages of 5 to 15, in which case it's called juvenile dermatomyositis. And then there's the adult one, which affects patients between the ages of 40 to 60. Now, the adult dermatomyositis can be a paraneoplastic process, which means that there is a cancer somewhere in the body that's irritating it and causing this reaction on the outside. And in this case, dermatomyositis can run in families, so there can be a genetic part to it. As far as how is dermatomyositis diagnosed? Well, just like everything else in rheumatology, it really is what the patient is describing, matching it up with what is on their body, and then doing the labs and tests to confirm the diagnosis. So in this case, we are looking for the patient not feeling well for about a month or so, even longer. So having low-grade fevers, losing weight for no reason, tiredness, having that proximal muscle weakness, having that trouble swallowing, having those photosensitive rashes, having that Raynaud's, maybe a little short of breath, etc. And then also ruling out the common things, which is very important. I only need 50 people in a room for one person to get thyroid disease. And thyroid disease can give some of the symptoms that are similar to this condition as well. And then the labs and tests, they do show high inflammation. They show a lot of muscle breakdown, but then they will also have some specific autoantibodies, which are more specific labs for this disease. In these patients, you can also do what is called an EMG, which is a muscle test, which is basically you go to a neurologist and they stick little needles and they try to see if the muscles are working properly. And then also, MRIs can show swelling of different muscle groups inside the body. And then finally, in some patients, a biopsy is needed where you take a bit of that muscle tissue, you put it underneath the microscope, and then you can see that reaction happening. As far as how is dermatomyositis treated? Well, just like a lot of things in rheumatology, the patient is put on steroids to calm that reaction down, and then they are given a steroid-sparing agent, so a medicine that will do the job of the steroids, but without the steroid problems. And in this disease, because of that photosensitive skin stuff, it's important to avoid sun exposure. And then also physical therapy, once the muscles have calmed down a little bit and the patient is in less pain from the muscle weakness and having more have more ability to take part in physical therapy, then that can be prescribed. Finally, how well do these patients do long term? Well, in dermatomyositis, the prognosis is actually pretty good. Once the patient is treated, they do very well. And in fact, some patients, the disease actually completely goes away. But in these patients, that perineoplastic part, that part where you have to kind of aggressively look for any cancer, is very important. So this is the case where the patient has to be asked, what kind of work are they in? What kind of environmental exposures do they have? What kind of habits do they have, like smoking or something that would put them at increased risk for cancer? What runs in their family? Like maybe there is a certain type of cancer that's very unique in this patient's family. And then finally, maybe it was a hard year and the patient wasn't able to go for their routine cancer screenings or their routine checkups to their doctor. And to me, this is probably one of the most interesting parts of medicine because I feel when you get to know people more, you begin to understand them better, and then you begin to care more about their well being. I think the ancient Greek physician Hippocrates said it the best: wherever the art of medicine is loved, there's also a love of humanity. Until next time.